Hello, everyone. Welcome to this video. I'm really excited to be talking with Linda Homeyer today, somebody that in the play therapy world has been such a cool inspiration to me. And I think I've shared this with you. We're going to talk about Sandtray Therapy. And Linda knows all about this. And I think I've shared this with you before, but I can't remember. My very first Sandtray training was with you
Oh,
years ago, like when I was first starting out in my career. I was just kind of
uh-huh.
getting into play therapy. And so randomly found myself at a Sandtray training. I did not even know what it was. I can't even remember what brought me to it, but I was hooked.
Yeah.
Oh my
It
God.
has that tendency to I remember I used to, when I was at Texas State, I taught a Sandtray therapy class, and a student came and took it and said later, I took it because I wanted to prove to myself that it was a lot of hooey.
And
And now
just
he
the opposite.
yeah, now he's one of the biggest Sandtray folks around.
I love it. Well, this is our topic, Sandtray Therapy. And I know that people watching this, some of them maybe have never heard of it, and
Okay.
also some maybe have ideas about what they think it is. Of course, we both know it's kind of actually a kind of a big term, but I'm going to turn it over to you to kind of define for us what is Sandtray Therapy.
Okay. So this is a kind of a big topic, and I kind of have a little soapbox about Sandtray
Okay.
therapy. So first, I want to tell folks that I am also now involved in a new association entitled the World Association of Sand Therapy Professionals.
Okay.
So it's even a broader term of sand therapy, under which we have sand play, which is the Dora Kolfian very specific theory, and then Sandtray, which is everything else.
Okay.
So
Right.
we're just trying to develop globally a bigger picture and more interaction with all the different forms of using a sand in a tray with miniature figures.
I love it.
Yeah.
That's
And so we have just finished a research project to develop competencies for sand therapy professionals.
oh great.
So again, just trying to really, um, as the field has exploded in the last like 20 years, it's just really exploded. The whole Sandtray therapy, whatever that really means, and I'll talk more about that in a minute. But part of that is we need to mature in the area of research and definitions and being a little more precise in our language. Um, Instead of generic Sandtray therapy is what? Well, it's not just like play therapists. We get ruffled feathers when someone says, I'm a play therapist, and we know they just have a basket full of toys in the corner,
Right.
right? Being a sand tray therapist is not having a tray of sand with miniature figures,
Right.
either in your playroom or in another room, right? So it it does require very specific training and supervision or consultation. And you need to know what you're doing because it can be and is a very powerful therapeutic tool. And that's what surprises a lot of people is clients can go very deep very quickly, especially clients that have trauma in their history, which is probably 90% of our folks that end up in a counseling room, right?
Right. Right.
Or children can take it in lots of ways that we're not prepared for. So have to have training and supervision. So that's really, really so critically important. And see, I'm looking at my notes because I did write down some points I wanted to be sure to cover. Um, and so just like with play therapy, we have different theory and approach applications.
Mhm.
Same thing with Sandtray. So Sandtray is in fact a generic term. So you could be an Adlerian Sandtray therapist or a child-centered or person-centered. You can be Jungian without being a Dora Kolfian Sandplay person,
Okay.
right?
Yeah.
Um, you can be cognitive behavioral. You can be solution focused. You can be lots of different things, but you need to know how to use the materials and, more importantly, how to interact with clients, because we know that there's such a tactile sensory component to it. And this kind of goes into your next question about who is it for,
Mhm.
is that it can activate or trigger a lot of right brain fragmented memories that unless you've been trained to be prepared to handle those and know how to see them, for one thing.
Right.
Can you identify when someone's starting to dissociate, or they're going out of their window of tolerance, or whatever framework you use to understand that? That's why training and supervision is so important.
Yes, I love that. And just all those different components that, um, from the association to the research, the competencies, and the supervision, just stressing the legitimacy and the importance of, just like what you said, that you take the time and spend the time to learn how to do this modality, this type of therapy.
Right.
It's not just frivolously throwing together a tray and some miniatures, and the onlooker might see, like your background, right? Here's
Right.
just
Right.
miniatures and a tray, but there's so much more to it than what you're just seeing there and what you're assuming might be going on.
And all of our codes of ethics say when you start working in a new area of counseling, you need to have training, experience, and supervision to be
Yes,
competent.
absolutely.
And, yeah.
So you and I talked about this, have talked about this before, but just for the video, Sandtray therapy technically is not a play therapy theory, although a lot of play therapists gravitate toward it and probably use it and learn about it. But certainly it's something that is done by people who are not play therapists as well.
Yes, yes. And that's one thing that I was really hesitant to become involved initially with the World Association of Sand Therapy Professionals, because all my professional career, my Sandtray work has been enveloped underneath the APT, Association for Play Therapy umbrella. But I have come to learn that there are lots and lots and lots of folks out there who do not identify as a child therapist or a play therapist. And they've been doing Sandtray therapy for years.
Right.
So it's always interesting, isn't it, Robert, to see kind of the pathway of the development of some of these modalities. I mean, Margaret Lowenfeld, nearly 100 years ago, when she first started doing play therapy, had a Sandtray in her playroom.
Right.
So it had its origins within a play therapy room.
Yes.
Right.
Yeah.
And she also did nature play. Her playrooms had a door out into the garden so the kids could go outside. And she had a messy room where they could splash around in water and paint the walls. And I mean, she just did all kinds of outrageous things for her time.
Right.
But it has over time gotten interest by different clinical groups. And quite appropriately, to me, personally, it is a form of play therapy that we can use with older teenagers, with adults, with couples, because it still has those therapeutic powers of play.
Right.
Right. It still engages the creativeness that we use in play therapy, right, for these now adults.
Yes.
So for me, it's just a form of adult play therapy.
So well said. And I think that I can validate that just on the clinical front. And I think so many people who are out there who do Sandtray therapy and do understand it can validate that too. I mean, we just see the power from young children to teens to adults, which is one of the things that I love so much about it. And that does kind of get into the next question, which is, so who would be the clients for Sandtray Therapy, populations or issues or needs? And obviously one of them is anybody as far as age goes.
Yes. Yeah. Yeah. Initially I was way back when I was first writing and learning so much more about Sandtray, like 20 years ago, or more, there was this real sense that we should not be using it with clients that had tenuous connections to reality, right? But now we're seeing, and I'm hearing people talking about working with just, obviously with dissociation, working with, okay, I'm losing the current term, but multiple personalities, right?
Yes.
Dissociative identity disorders.
Yes.
And so it's a way to help integrate all those different personalities and alters. And so it really is, but those, if you're working with those kind of clients, you better have some really good training, period, as well as in Sandtray.
Yes.
Right?
Yes.
But yeah, so I think it's really, I don't see any contraindicated diagnoses right now that are being said not to use. But again, that means you have to be highly experienced and qualified in working with those populations, understanding the dynamics of those personality disorders, but that it's being used very effectively.
Yeah. It just, I haven't really seen a, certain diagnosis or therapy goal or need or age where, we wouldn't, do Sandtray. So oftentimes here in the clinic, in the AutPlay clinic, it's sort of like letting the kids lead in terms of their play preference. But young kids, elementary age, teenagers, they'll gravitate to the Sandtray room. They want to go in there. They want to get in the sand. They want to get in those miniatures. They want to do something.
Right.
And it's almost instinctual for them, I feel like, that they know they're going to do some work here. And it doesn't matter, and that's across diagnosis, across issues, therapy goals, which is so fun to see. And especially, I think, with some of my older teen clients who may be resistant to just everything else, honestly.
Yes, right.
But they'll just be drawn to the Sandtray, and they'll want to get in there and create and express and process through it.
Right. And probably because of my age range now, I am more interested in working with geriatric clients with Alzheimer's. I'm the editor of the journal for the World of Sand Therapy, and this month's journal article is research on using Sandtray with Alzheimer's patients.
Oh, wow. That's great.
So it is, so you're talking about this wide age range and different developmental tasks. And so again, but that's why it's important to have the training, because if you're seeing a middle school boy and he keeps doing all of these armies in the tray, we don't want to say he's fixated on aggression. No, it's a normal developmental age way of being in the tray.
Right.
So you have to know that, so you don't misinterpret what's going on.
Absolutely.
Yeah.
Well, obviously there are so many things about doing Sandtray therapy. From somebody might be watching this and even seeing your picture going, okay, so you use these miniatures, doing a Sandtray. How do you set that up? What's it all about? If somebody wants to dive deeper into this subject, they want to read more about it, they want to do trainings, what are some resources? And I'll make sure that they're on the video too.
Okay.
So people can access them very easily.
Okay. Well, without self-promoting too much,
you can. Yes, you can.
Daniel Sweeney and I have written a book that's now in its fourth edition, which all by itself is mind blowing to me.
Yes.
It's entitled Sandtray Therapy, a Practical Manual. And
Yeah.
that's just a very good beginning place to say, this is how to set up a room. This is the categories. These are the miniatures to buy. And this is kind of where to how to get started. And then Marshall Lyles and I have written what I would consider like the next book, which is Advanced Sandtray Therapy, digging deeper into clinical practice. And that goes into much more detail with specific populations, a lot of dissociative work, working with the elderly, not just Alzheimer's, but just old folks, right? There's a lot of us out here now. and and that, and then, there's just training everywhere. At the Play Therapy Conference in October, I'm going to be doing a full day on basic Sandtray 101.
Awesome.
Our World Association is doing webinars, like 3-hour webinars and conferences now all the time, so people could find that there. APT branches are doing it. I'm going to be in North Carolina doing 2 days of Sandtray training in the first weekend of November. There's people that have certificate programs. There's all kinds of basic starting kinds of training, as well as finding your niche and then getting some in-depth training with, like Terry Cotman does, Adlerian Sandtray, just finding that kind of area that already matches the way you work with clients.
That's great. And I think that the World Association is a great place to connect and find out about trainings, even more information. You can be contacted directly to do a training for somebody.
I could, yeah.
Yes. So, and those 2 books you mentioned, by the way, are excellent. I mean, I love those books. I've used them. I've read them. I think I have all 4 editions of the Sweeney and Homeyer.
Yeah.
But
yeah.
they're really, really good.
Thank you. Thanks.
And I think that all the resources that you mentioned are spot on for somebody who wants to take a deeper dive. Mm-hmm. So there you go, folks. If you're interested, and you should be, because it's really a great therapy. Check out.
Let me also say the journal that I'm the editor of is an open access journal. It's online. It's open access, which means free.
Which is so nice for us in clinical settings.
So while we would like you to be a member, our board, I'm not on the board, I'm on the advisory board, but the board of directors decided, when we really started getting down to establishing the journal, I really pushed that if we're going to be an international journal, we want it to be accessible by everyone, regardless of their ability to have resources to join yet another association to be able to get access to the journal.
Right.
And so our whole membership is supporting it by saying, yes, this is part of what we want our association to do, is to make this journal accessible for free. So when you go on the website, you can go back and look at all the they're all archived. You can go back and see the previous issues and read all of them. And there's some book reviews there. And there's some information and book reviews in Spanish. We're working on getting some other international authors who will get it published in English as well as their original language.
That's awesome.
Yeah.
So give us the full name of the association one more time.
Yeah. World Association of Sand Therapy Professionals.
Got it. And I'll make sure it's up here with a link to their website.
And then on that website, obviously, is a link to a tab for the journal.
Excellent.
Yeah.
Yay. I'm so excited that we got to do this. And I hope that, it helps people learn a little bit more, maybe even pique their interest, and they'll pursue learning more about it and offering it for their clients.
Right.
Yeah. So thank you so much for joining me and joining everybody who's watching.
You're
So
welcome.
appreciate you and the work that you're doing. And we're going to sign off. Thanks everybody for
Okay, bye.
watching. Come back and check out more videos.